our goals are for the Leukemia Lymphoma Society are one, to obtain cures for blood cancer. That is the primary mission of LLS, and it's been so for the last 70 years since the organization has been in place. We're also interested in providing patient access. So in other words, with all these great new medicines that we have for blood cancers, people have to have access to them, to the best therapies, to the best clinical trials, to be able to pay for these medicines. And I know that's critically important for patients with Waldenström's, many of them who are on BTK inhibitors, and I'll pick up on that thread in a moment. And then also at the government, our patient access is not only at steering patients and educating patients, getting patients onto clinical trials who need them, but also at the government level, making sure that the government, that we're advocating at the federal and state government level so patients can get access to these medicines. I do want to come back to one thing which I left off before. Many Waldenström's patients are getting BTK inhibitors, Bruton tyrosine kinase inhibitors. Those drugs can be immunosuppressive and cause those patients to fail to produce anti-spike antibodies. So if you're on a BTK inhibitor, or if you're taking anti-CD20 antibodies, such as Rituxan or obinutuzumab, they are immunosuppressive. They knock out B cells. B cells produce antibodies. If you get vaccinated, the B cells are supposed to produce antibodies, but they often don't. So patients with Waldenström's who are on BTK inhibitors, and certainly those of the anti-CD20 antibodies, including patients who have had anti-CD20 antibody and stopped taking it in the last 6 to 12 years, 6 to 12 months, that is months, can fail to produce anti-spike antibodies and therefore remain at risk. So many Waldenström's patients, those are the patients who we want to help overall because BTK inhibitors are useful in Waldenström's, but they also can block COVID responses. And so just a big picture, LLS is interested in cures, interested in patient access, and in the last 2 years, we've been focusing on the response to COVID-19, the vaccines, the antibodies, and now the antiviral treatments.